Have you taken your blood pressure pill today? If you did, you probably swallowed it with a sip of water and went on with your morning without giving it another thought. Millions of people do exactly the same thing every day. But if you're over the age of 60 and you're taking amlodipine, losartan, or lisinopril, there's something you deserve to know. These medications have helped countless people live longer and reduce the risk of stroke and heart disease. Yet many older adults are never told what to expect after they begin taking them. They notice changes in their body, assume it's simply part of getting older, and stay silent. Sometimes that silence creates more problems than the medication itself. I remember one of my patients, Mr. James. He was 75 years old, a retired engineer who never missed a doctor's appointment and never forgot a single pill. He believed that taking his medication exactly as prescribed meant everything would be fine. Then, one afternoon, his daughter called my office. "Dr. Kang," she said, "my father barely leaves the house anymore. His feet and ankles have become so swollen that he refuses to wear his favorite shoes. He's convinced his heart is failing." When I saw him a few days later, I discovered something surprising. His heart wasn't getting worse. His kidneys were working normally. The swelling was actually a common side effect of the medication he had been faithfully taking every morning. The real danger wasn't the swollen ankles. The real danger was that he had quietly started skipping doses because he was frightened and embarrassed without ever telling anyone. His blood pressure slowly climbed back up, placing him at a much greater risk than the swelling ever did. My name is Dr. Kang. I've spent more than 3 decades caring for older adults with heart disease and high blood pressure. During those years, I've learned that medication works best when patients understand what it's doing inside their bodies. Today, I'd like to explain 9 important things every senior taking amlodipine, losartan, or lisinopril should know. These aren't secrets your doctor intentionally kept from you. The reality is that office visits are short, and there simply isn't enough time to explain everything. By the end of this video, you'll understand what these medications actually do, which side effects deserve attention, which ones are usually harmless, and when you should contact your doctor immediately. Before we begin, I'd like to ask you something. How old are you, and which blood pressure medication are you taking? Write your answer in the comments below. Many people reading those comments will discover they're not alone in what they've been experiencing. Now, let's begin with the first and perhaps the most misunderstood fact about these medications. 1. These 3 medications lower blood pressure, but they do it in completely different ways. One of the biggest misconceptions I hear from patients is this: "Dr. Kang, aren't all blood pressure pills basically the same?" The answer is no. They may all lower your blood pressure, but they work through completely different mechanisms inside your body. Because of that, they produce different side effects, different benefits, and different warning signs. Let's start with amlodipine. Your arteries are surrounded by tiny layers of smooth muscle. Those muscles naturally tighten and relax throughout the day, helping control blood pressure. For the muscles to tighten, they need calcium. Amlodipine partially blocks calcium from entering those muscle cells. As a result, your arteries stay more relaxed, allowing blood to flow more easily and reducing pressure against the vessel walls. Think of it like opening a hallway during rush hour. The traffic doesn't disappear, but it moves much more smoothly. That simple change can significantly reduce your risk of stroke and heart attack. Now let's talk about lisinopril. This medication works in an entirely different way. Your body naturally produces a hormone called angiotensin II. Its job is to tighten blood vessels and help your body hold on to salt and water. While that response can be useful in certain situations, it also raises blood pressure. Lisinopril blocks an enzyme called ACE, which your body needs to produce angiotensin II. Without that enzyme, much less of the hormone is created. Your blood vessels remain more relaxed, your heart doesn't have to pump as hard, and your kidneys are often protected from long-term damage. That's one reason lisinopril is frequently prescribed for people who have diabetes or early kidney disease, in addition to high blood pressure. Now, what about Losartan? Losartan works on the very same hormonal system, but from a different angle. Instead of preventing angiotensin II from being produced, Losartan simply blocks the receptors where that hormone normally attaches. Imagine someone ringing your front doorbell. With Lisinopril, it's as if the visitor never leaves home. With Losartan, the visitor arrives, but no one answers the door. The signal is there, but your blood vessels never receive the message to tighten. This difference explains why patients who develop a persistent cough while taking Lisinopril are often switched to Losartan. Both medications lower blood pressure effectively, but they don't always feel the same to the person taking them. Understanding which medication you're using helps you recognize what's normal and what deserves a conversation with your doctor. Now let's discuss the side effect that worries more patients than almost any other: swollen ankles caused by amlodipine. It's one of the most common reasons people stop taking their medication without telling anyone. #2. Why amlodipine causes swollen ankles and why you should never ignore it. If you're taking amlodipine, you've probably noticed that your shoes fit perfectly in the morning, but by evening they feel tight. Your socks may leave deep marks around your ankles. Some people even notice that one shoe suddenly feels smaller than the other. Naturally, this can be frightening. Many patients immediately think, "My heart must be getting weaker." Fortunately, that's often not the case. Here's what's actually happening. Amlodipine relaxes the small arteries throughout your body very effectively. Blood flows into your legs with much less resistance than before. But the tiny veins that carry blood back towards your heart don't relax nearly as much. Imagine pouring water into a sink while the drain remains partially blocked. The water continues flowing in faster than it can flow out. Something similar happens inside your lower legs. A small amount of fluid gradually leaks into the surrounding tissues, creating swelling around your ankles and feet. This swelling is usually worse after you've been standing or sitting for several hours. During the night, while you're lying flat, gravity is no longer pulling fluid downward. That's why many people wake up with normal-looking ankles, only to see the swelling return later in the day. By itself, this type of swelling does not necessarily mean your heart is failing. It does not automatically mean your kidneys are damaged, and it certainly doesn't mean the medication has stopped working. In many cases, it's simply a predictable side effect of how amlodipine works. But here's where patients often make a dangerous mistake. Instead of calling their doctor, they quietly begin skipping pills. Maybe they only take the medication when they know they'll be staying home. Maybe they cut the tablets in half. Maybe they stop taking them altogether because they're embarrassed by how their legs look. Unfortunately, blood pressure doesn't take days off. Every missed dose allows it to rise again. And high blood pressure rarely causes symptoms while it's quietly damaging your brain, heart, kidneys, and blood vessels. I once cared for a woman in her early 70s who had developed noticeable ankle swelling after starting amlodipine. She never mentioned it during her appointments. Instead, she simply decided to take the medication every other day. Several months later, her blood pressure had climbed back into a dangerous range. She thought she had solved one problem. Instead, she unknowingly created another. The good news is that swelling caused by amlodipine can often be managed. Sometimes adjusting the dose helps. Sometimes combining it with another blood pressure medication reduces the swelling. Sometimes simple lifestyle changes, like elevating your legs after long periods of standing, walking regularly, or wearing compression stockings recommended by your healthcare provider, can make a meaningful difference. The important thing is this: don't make changes on your own. Always tell your doctor what you're experiencing. A side effect is a conversation, not a reason to silently stop treatment. Now let's move to another medication that causes a completely different problem: a dry cough that many people don't realize is coming from their blood pressure medicine at all. Final thoughts. Before we finish today, I'd like you to remember one simple truth. Blood pressure medication is one of the most effective treatments we have for preventing heart attacks, strokes, heart failure, and kidney disease. But no medication works well if the person taking it doesn't understand what it's doing. Too many older adults believe they have only two choices: either take the medication and live with uncomfortable symptoms, or stop taking it altogether. In reality, there is almost always a third option. Talk to your doctor. Most side effects can be managed. Sometimes the dose can be adjusted. Sometimes switching to another medication in the same class solves the problem completely. Sometimes the answer is as simple as changing when you take the medication or reviewing another medicine that's interacting with it. The important thing is never to suffer in silence. Remember these key points. If you're taking amlodipine, watch for swelling in your ankles or feet, especially later in the day. Report it, but don't stop your medication on your own. If you're taking Lisinopril, tell your doctor if you develop a dry, persistent cough. But if you ever notice swelling of your lips, tongue, face, or throat, or have trouble breathing or swallowing, seek emergency medical care immediately. If you're taking Losartan, ask your healthcare provider whether your potassium and kidney function are being monitored regularly, especially if you're using salt substitutes or potassium supplements. And no matter which medication you're taking, check your blood pressure the same way every time. Take your medicine consistently. Stay well hydrated unless your doctor has advised otherwise. Keep your follow-up appointments, and never be afraid to ask questions. Over the years, I've learned something that medical school never truly teaches. The healthiest patients aren't always the ones taking the newest medication. They're the ones who understand their condition. They recognize changes early. They communicate openly with their healthcare team. And they make informed decisions instead of fearful ones. Knowledge doesn't replace medication, but it allows medication to do what it was designed to do. If today's video helped you better understand your treatment, I hope you'll share it with someone you care about. A simple conversation could help another person recognize a side effect they've been ignoring, or encourage them to ask a question that changes the course of their health. Now I'd like to hear from you. Which medication are you taking? Amlodipine, Losartan, or Lisinopril? Have you experienced any side effects that surprised you? Leave your answer in the comments below. I read as many comments as I can, and your experience may help someone else realize they're not alone. If you enjoy clear, practical health information designed specifically for adults over 60, be sure to subscribe and turn on notifications. Every week, we'll continue separating medical facts from common myths so you can make confident decisions about your health. Thank you for spending this time with me. Take good care of yourself, stay healthy, and I'll see you in the next video.